The more normal it is, the better.
Yeah.
Right, just thinking else. Hi, I just thought we'd do a little video of one of my patients, Jane, who's been through quite a few procedures, and she'll tell you all about it in a minute. I think it's just important that people get to hear the story, get to hear about recovery, get to hear about why people have had their surgery, all those sorts of things that I commonly get asked in the clinic. So I'll let Jane tell you a lot about what she's had done and why she had it done. And I think the most important thing is the things I don't know, which is all about the recovery and what you can do and what you can't do and what it's really like to go through the surgery. So Jane, tell us about what you've had done then.
What I've had
There's
done.
a few things, wasn't there?
I've had breast uplift, I've had tummy tuck, I've had lipo, and I've had arms done. So they're
It was
all
a
in
long
one go.
day in theatre.
Yeah, it was.
Was it worth it, do you think?
It was most definitely worth it. Nothing, I have to say, honestly, nothing has been as bad as I expected. I really did think that the recovery was going to be longer, it was going to be harder. I did do, I think one word of advice that everybody should adhere to is whatever you're told to do, do. If you're told to stand upside down with your head in a bucket of cow milk and it's going to aid your recovery, do it.
We haven't asked many people to do that.
But I would have done it, and it has resulted in, for the amount of surgery I had no issues. I had one little issue with a stitch. I came straight back to the clinic. The nurses were fantastic and just redressed it for me, so there was no issue at all with that. The recovery was, I can't even say it was hard. I've got to say, when I opened my eyes, having been in theatre, and the smarting stinging is the only thing I can explain the pain to be. And that was in every stitch I'd had was smarting. And I thought, what have I done? This is horrific. The nurses were great. They said, right, just let us get you back to the room. It'll be fine. We'll get you back there. Got back to the room, got off the bed myself, got into a wheelchair, got back to the room, went for a wee on my own. So that was straight after the operation. Got the garments on. Again, that was something I was petrified of, but they went on, they were fine. And the next thing, I was linked up to a drip, paracetamol drip, and that was the worst of the pain. I hardly had any pain after that, and that was right through the recovery. I kept on top of the painkillers. I had the op thing on the Wednesday. By the Sunday, I was only on paracetamol, and I was taking the paracetamol and cocodamol at night, literally just so I would sleep. I sat upright, I had my knees bent over a pillow, I was petrified to move in any way, shape or form, because that's the way I was told to lie, and that's the way I was going to lie. I could get out of bed, I could go to the toilet. One thing I would say, and I would advise everybody, is to get a Shiwi. Absolutely well worth the £4.99 on Amazon. It really is. The other thing was, I set my phone for 5 minutes every hour. I got out of bed first thing in the morning. I got a wash, because obviously you can't have a shower. That is something that is hard to get used to, because I'm used to having a shower twice a day, and all of a sudden for 2 weeks it was a wash. Even my husband was giving me bed baths, and he was like, I haven't got one of them, I don't know how to wash it.
Dedication. That's what we like to do.
But yeah, you get used to it. So every 5 minutes I'd be sat down, and every hour, 5 minutes in every hour, I would then get up and walk around for 5 minutes and back down. And I did that religiously.
That's what we call a good patient, definitely. Because I tell everybody that. I tell everybody it's a partnership, and that I can do my bit, but the patients have to do their bit. And what Jane's doing and getting up, and that's moving all the blood around, that's making sure that you don't get blood clots, you don't get urine infections, you don't get chest problems, you don't lose your muscle, and that's definitely the best thing to do.
Well, drinking water I drink a lot of water anyway, but I drank gallons and gallons of water while I was sat there. I just iced water in one of the bottles, the sucky bottles that are easy to get water down. I did for a week. I took vitamin E and vitamin C tablets to help it. In fact, I didn't. I took them for, I think it was 4 weeks, until I knew that the healing was done. And then I don't really take vitamins anyway, but that was just because Apostolos had said, these are good for you. So,
very good advice. Apostolos, our new surgeon who's helped us out.
Yeah, I took that, and then I literally after the first week I went back to see Mr. Lamb, and everything was fine. Went back again after the second week. Again then, Mr. Lamb gave me more information, and then I think it was a week after that I went back to see the nurses just for a problem with one of the stitches. That was sorted out, and from then on it's just been little bit more every day. I even started cleaning up, but wiping the tops and then sitting down, until I was eventually able to, after the 6 weeks, start hoovering and brushing up, and now I'm pretty much back to normal.
So how many weeks are you now?
It must be 9.
9 weeks. That's amazing.
Oh, in fact, yeah, 9 weeks, I think it is.
I think it's important to say Jane's had more done than most people. Most people have a mummy makeover. It'd be the breasts and the tummy, but had arms, lipo.
Yeah.
Anything else?
Boobs.
Boobs. Yeah, it was everything. To be recovered from everything in 9 weeks is absolutely brilliant. People always ask me about driving. When do you find you could drive?
I could have driven after 2 weeks, but I left it 3 because it's just the thought of if you have to brake, anything like that, and I've had cesareans. That's one of the reasons I wanted my tummy tuck. But again, it's still muscle, and I'm not damaging what's being done for nobody.
That's what we like to hear. So tell us about how you feel now. You were saying before about how the change is a bit odd to deal with, and you feel a bit, you feel quite different in yourself.
I think when you come out of surgery and you get your garment on and you look down, your stomach is, I'd say, concave rather than flat. It's that flat. And then as time goes on, it swells, and all of a sudden you're thinking, hang on, where's my tummy tuck? Because I'm looking down and I've got the tummy, and that was supposed to have been taken away. And I'm squeamish, so I wouldn't look in the mirror. I looked down and I was thinking, oh, I can't look. I couldn't look at my arms. I couldn't look at my boobs. I was saying to everybody, just have a look at that and make sure it's all right. Even going to Mr. Lamb, I'll tell you, when I went to see him.
She was a very good patient. You were
yeah,
very,
but
very good.
I couldn't look.
Yeah, that's common, I think.
I didn't want to see. But then when all this sort of scabbing and everything, then when it didn't look nasty anymore, I looked in the mirror and I was like, oh my God, it is actually flat. But I still don't think it's anywhere near as flat as I'm going to get it, because as Mr. Lamb has always said, it's 6 months before the lipo, your tummy, you actually start seeing it, and 12 months until you get the full results.
Yeah, I think that's true. You get a lot of patients who particularly have their breasts done, and they get a lot of swelling at the top, and they're like, oh wow, this looks amazing, and then that tends to go down. And these changes and these fluctuations in your body, I think people aren't ready. They sort of see that before, they see that after, and everyone forgets that there's that journey of all the different stages. And sometimes you'll see it swelling, sometimes see it going down. I've had a lot of patients say that, this time of the day it looks great, and this time of the day it doesn't look so good.
But naturally it would anyway.
Yeah.
And your body, I mean, I might be wrong, but your body still does what it does. So,
no, I think that's very true. Your body changes, and people scrutinise it far more afterwards. I think that's one of the things that people don't realise. Yeah.
My belly button, I thought I was going to have a scar around, and my belly button's brilliant. It's just,
I like a nice belly button.
I've got to design a belly button.
So how do you feel in yourself now in terms of confidence?
Well, we're going away, and I can't wait to wear a bikini, because I'm going to have this, instead of this awful overhang, and mine wasn't an overhang, it was just a sausage. for a big sausage. It was horrible. And now it's gone, and my bum's lifted up as well.
Oh,
which,
bonus.
yeah, you know, it's not as droopy as it was. My arms, yes, I've got scars on my arms, but you can't see them. When your arms are down, you can't see them. I was recovered enough after 2 weeks to go to a winter ball at Christmas. And I went, I didn't drink, and I didn't have any alcohol until about 2 weeks ago. I stayed off alcohol completely. Again, I just was not prepared to put my body under any more strain and anything go wrong. But yeah, so 2 weeks I was actually able to go. I was walking slowly, but I had a nice jumpsuit on. Nobody knew. And that was my first night out after it. So
fantastic.
Yeah.
All in all, really, really good to hear.
You know, it's. But I think a lot of it as well. You've got to do your research. I was booked in I think it was 2010 in Spire, Liverpool, to have my boobs and tummy done, and I paid a deposit and everything, and I was all set to go. And a week before I was going, I had a phone call to say, at the time it was Lewis, and Spire were taking over, and they were putting it up by £5,000. And you know, it was just in my head. I was like, that's put me off completely. I don't trust the hospital, and I didn't have it done. And it's taken me till now to actually say, well, no, I am having it done.
So tell us about the research you did and what helped you decide to come to us.
I researched, I don't know how many doctors. One doctor, one consultant I researched, and I spoke to him. And he was at Nuffield in Chester.
Yeah.
And he sounded really nice, and his sort of bio on him seemed really good. And I spoke to him, and I thought, oh, yeah, he's a nice man. I sort of liked what I'd read about him. And then I rang Royal Nuffield because I went to do the checks to see if he was part of the whatever it is, the
BAAPS box.
Yes.
Yeah.
And they said I couldn't find him, so I rang Nuffield, and Nuffield said, "Oh, we only need them to be on the General Medical Council. We don't check if they're on anything else." And he wasn't. And
well,
again, that I was, no, that's not gonna. I'm not going there. And then I researched the area, and that's how I found Mr. Lamb. And I read him everything. He was where he should have been.
Try to do our best on that.
And then after the first meeting, I just knew then that this is who I was going to go with. And I've got friends that have been over to Lithuania and had surgery done. And yes, fine. But I would not want to be over there if something went wrong. I would not want to have to get on a flight and come home. You know, it's not for me.
No, I always say to my patients, you know, if I was going to do your surgery and then fly away the next day, people would be like, well, what do you think you're doing? And I think it's similar if you know, the patient and you go to Lithuania and then you come home where you're miles and miles away and you can't have the care, you can't have the support.
But you can't have anybody, you haven't got anybody with you.
Yeah.
And you need help, you know. It's not something to take lightly. You know, as much as I've recovered really well, and it's not the end of the world, it certainly isn't, it's still not something you go into thinking, you need to know what you're doing. You need to have your head in the right place, and if something goes wrong, you need to be... Well, one of the reasons I chose Asset was because I thought, if I have a heart attack, Whiston Hospital's there.
That's true, yeah. She had surgery in Asset Hospital in Liverpool, and it's right next door to Whiston, and we have full NHS support there, so it does work very well. Tell us about where you first made inquiries and spoke to Jane, our practice manager. How did that go?
Great. Well, as soon as I spoke to Jane...
We have to say that because she sat on the other side of the camera.
No. Jane was brilliant, and she was honest, really honest about everything. And Jane's been with me every step of the way, telling me what to expect. Also, the mental ups and downs you have. And to be fair, I've not experienced any downs, but I'm a positive person anyway, so... But you have to know it doesn't just affect your body. It does affect your head and everything. And you know, in my head, and I know when I spoke to Mr. Lamb for the first time, I said, right, see that bit of fat there, walk across the room, and when you can't go any further, take another step and then you can cut it off. I said, and in your head, you think you're going to look like a 20-year-old. A miracle worker he is, Harry Potter he isn't.
Thank you. I'm taking the glasses off today, I've got the scar though.
And what he said to me was, I can give you perfection, but I can only give you perfection to what I've got to work with. And that was the best thing that he could have said to me, because you do realise then that your body is your body and you can't make it any different to what you've got. You can make that part of your body better, and it's unbelievably better, but you can't change what you haven't got.
Yeah, that's true. Some people come and it's I remember one of the ladies had like the biggest, heaviest, worst tummy I've ever seen in my life, and we took her up to the fleur-de-lis, which really take a big chunk out here, but she had this tiny little waist underneath, and when you put her together, she got this great waist, this great shape. But some people come and they're just this straight up and down.
That's me. I am straight up and down, and I've got really narrow hips. I've never had a waist, and for me to think that I was ever going to get a waist, if you haven't got it, you can't make it.
That's true.
And that's what you've got to realise, you know, when you do go into this.
I don't know if we can say any more.
Anything else? What can we do?
I think we've got more to do.